Hi everyone. Today I'm going to explain about what is pharmacokinetics and what is pharmacodynamics. So first, what is pharmacodynamics we are going to see. Okay. See, before going to that, pharmacodynamics in short form it is said as PD, and pharmacokinetics in short form it is said as PK. Okay. So what is pharmacodynamics? So, pharmacodynamics and pharmacokinetics are most important in terms of pharmacology. While learning pharmacology, like we should be first clear about what is pharmacokinetics and pharmacodynamics. So, what is pharmacodynamic means? Pharmacodynamics is the study which says about what the drug does to the body. See, pharmacodynamics explains pharmacodynamics is this a study which deals with what does the drug does to the body. That is pharmacodynamics. See, let us go with the example. Suppose if a person he's having headache, so he's taking some tablet. Okay, so the person is taking the tablet. After sometimes the headache is gone. How? The question arises how after consuming tablet the headache is gone, but how? What did the tablet do to the person's body? That is what pharmacodynamics. What the drug does to the body. Here see here he's having the tablet. After some time the headache is gone, so the tablet is doing something. No, what did the tablet do? What the drug does to the body. So this is known as pharmacodynamics. The drug or the tablet have done some alterations in the body so that it producing some effect. Here it has done some effect, or it has altered something, so the headache or the pain is gone. That is pharmacodynamics. See, the tablet did some magic work. No, see, after consuming the tablet the headache is gone. That means the tablet is doing something magic work. So what did the tablet or drug did to the body? What did it do? So the headache is gone. The tablet might the tablet might acted on some receptors or any pathways. In humans, many receptors are there, many pathways, those are there. So the tablet might acted on some of these receptor or pathway, so they might inhibit or promote certain messengers. Like this the tablet might do anything in the body to give the relief. Okay, so this is the explain so this was one example given. So see, so once again, like I'll explain about PD in a short and crisp. See, it explains about how the drug work. See, after we are taking the tablet is doing something in your body. We are going to study about that. What did the drug do? See, if you look into the main definition itself, you will be able to know what the drug does to the body. What did the drug do? Was if the drug had done something to your body, so only the effect you are getting. What the drug does to the body. See, simply pharmacokinetics, you can also say pharmacokinetics is the study which says about what the drug does to the body. Okay, so in pharmacokinetics we'll also learn about how the drug is working, the mechanism of action of drug. The drug is having some mechanism. No, it will act on certain pathways, certain receptors. It is having some mechanism that result of that end of the mechanism of action only will get that effect. So how it produces its effect once it reaches the target site. The drug is there. The drug after administered, after it get administered, it will reach the target site. Then it produces some effect. So we are going to study that and all. So in pharmacokinetics there are some key concepts which we'll talk about. The first one is drug receptor interaction. So here why we want to talk about in pharmacokinetics these concepts and all means. See, the drug is there, X drug. After consuming the drug is producing some effect. Okay, some it is producing effect. So we already studied about what the definition of pharmacodynamics, which is nothing but what does the drug to the body. Here what the drug is producing some effect, no, that is known as pharmacodynamics. This effect may be positive effect or negative effect, which means desired effect or therapeutic effect. Sometimes the drug might produce the derived desired effect. Desired effect means, suppose you are taking paracetamol, that is it have to cure the headache, that is desired effect. Desired effect or positive effect, and the negative effect is like unwanted effect, side effect. If you take overdose of paracetamol means it can lead to liver failure, like liver toxicity, that is negative effect. So here the paracetamol is producing, the positive effect is it cures the headache, negative effect is sometimes liver toxicity, it is C. So the paracetamol is producing two effects, but like mostly we'll study about this positive effect only, because the major or intended effect or the therapeutic effect of paracetamol is to reduce fever only, fever or headache or pain, such things. Okay, this is the main effect of paracetamol. So, so nothing but pharmacodynamics is what the drug does to the body, what the drug is doing to the body. In this case, paracetamol is reducing the body, reducing the headache. That is the work paracetamol is doing. Okay. So here the drug receptor or interaction. We are studying drug receptor interaction with respect to PD is, see the drug is doing something to the body. What drug does to the body is pharmacodynamics. The drug is doing something that to the body, that is pharmacodynamics. So so the drug is doing something means the drug first have to bind to a receptor, then only it can do its action. Okay ma. So see, the drug bind to receptor, the drug first have to bind to receptor, then only it can show any effect, that is positive effect or negative effect. The drug may majorly produce two effect. One is antagonist effect, another one is antagonist effect. If we go into antagonist effect means the when the drug bind to the receptor get activated, the receptor will get activated and produce response. If the drug is antagonist, it blocks the receptor and it prevents the response. Okay, so the effect of the drug is, so the effect of the drug is, it is depending on the drug receptor interaction. Only when the drug bind to the receptor it may produce the agonist or antagonist effect. Okay ma. Then dose response relationship. See again, why we are learning dose response relationship with respect to pharmacodynamics, because pharmacodynamics is, again I am saying, pharmacodynamics is what the drug does to the body. See, the drug may produce good effect or bad effect, which is positive or negative. Okay, but the positive effect is also depend on dose, negative effect also depend on dose. See, each and every effect is depending on dose only. The every effect is depending on dose. Certain amount of dose, that is 5 mg, 10 mg, 15 mg, 20 mg, certain dose is nothing but amount of drug. Okay, so it certain amount of dose should be given to produce the effect. Effect is always depend on dose ma. Okay, it it is like dose dependency. The effect is always depending on the dose. If we give high dose, more receptors will be occupied, then greater response. If we give a low dose will leads to like low receptor occupied, so decrease the response. Okay, so always the dose is the effect is depending on dose. So only dose response relationship, effect is depending on dose or the response is depending on dose. That is, we only are studying dose response relationship ma. And like in dose relation, in dose response relationship, we have to also know about potency. So what is potency means, how much drug is needed for a effect. So that drug A is there, drug B is there. drug A we are administering 5 mg and drug B we are administering 10 mg. In both also producing pain relief only. For same effect, two drugs are administered, but this is 5 mg, this is 10 mg. So this also giving pain relief. This drug A is also giving pain relief. Drug B is also giving pain relief. But see, drug A requires only 5 mg, drug B requires 10 mg. Here more amount of drug is required. So drug A is more potent than drug B. Okay. See here, in case B high dose. Here low dose. In low dose, the effect is pain relief effect is produced. So this is more potent, this is less potent because 10 mg is there. Okay, it is not like low dose more potent when the situation is comparing to A drug and B drug. A drug in 5 mg producing the effect, if same effect, the B drug requires 10 mg. Okay, see, two persons are there. One is A person, one is B person. He want to lift one bag ma. Okay, the two persons are there, A B. They want to lift a bag. So to lift a bag they need energy. A person eating 5 idli and lifting the bag, but B person eating 10 idli and lifting the bag. So he's eating 10 idli, then only is getting the energy to lift the bag, which means A is very strong because he is eating only 5 idli, no. So A is very strong. So that is why A is more potent ma. It is like that. And efficacy is nothing but maximum effect a drug can produce. Suppose like here we can say is that drug A is more efficacious for pain relief than B. See, in the above situation itself, same example, because in drug A is more efficacious because only if it is more potent. Okay, drug is, this is more potent than drug B. So more potent drug is high efficacy for pain relief than drug B. Okay. Next is the therapeutic effect versus side effect ma. What is the relationship the pharmacodynamics is having with respect to therapeutic effect and the side effect? See, the pharmacodynamics is nothing but what the body does to the, what the drug does to the body ma. What the drug does to the body. Generally the drug does two things. One is desirable effect, and the another one is undesirable effect. Desirable effect means it can relieve or it can cure the disease, it can relieve the pain. Undesirable effect is like side effect or any extra unwanted effect. It can causes nausea, vomiting ma. That is this thing. So the drug is doing something to the body, it can do. One is good. See, desired effect is, as we speak previously, it is positive, and the undesired effect is negative. Next is pharmacodynamics with respect to therapeutic index. What the drug is doing to the body, the drug is producing, the drug is doing, one is desired effect or undesired effect. But if you look into therapeutic index talks about safety margin of the drug. When the drug is having higher therapeutic index, the drug is more safe. When the drug is having low therapeutic index, the drug is very low nature and safe. Okay ma, that is the thing. So suppose like we will also see an example of paracetamol with respect to pharmacodynamic ma. So generally paracetamol produce antipyretic, analgesic effect, and sometimes anti-inflammatory effect also. So how paracetamol produces its effect on the body after it reaches the target site, or what and all the drugs do, what and all the drugs do to the body after it reaches the target site. So after administering the drug has reached the target site. Now it is produce some what and all it's producing, the it do One is positive or negative. These are the two things which a drug can do, positive effect or negative effect. This is nothing but pharmacodynamics. What the drug does to the body, the drug does to the body, two effect, positive effect, negative effect. That is pharmacodynamics. And it is how and all it's doing, the mechanism of action, that and all will study. So it may do good things, also bad things also. And pharmacodynamic explain how does it do these effects, these good or bad effect, good or bad activity. Pharmacodynamics explains how does it do this good or bad activity. So how does paracetamol do the activity? Means paracetamol inhibit COX enzyme. Okay ma, it inhibits the COX enzyme, so the prostaglandin production will be decreased, so pain or fever will be gone ma. Okay va, this is the positive effect. Okay, this is the positive effect. If you having fever, if you consume paracetamol tablet, it inhibits the COX enzyme in the brain, so the prostaglandin production will be decreased, and ultimately decreases the fever or pain. But what about the negative effect? Means if we take over a high dose of paracetamol, it can cause sometimes liver damage also. See, this is the pharmacodynamics. Okay ma, what the drug does to the body. Here the drug is paracetamol. What the drug does to the body, what it is doing to the body. One thing is it is decreasing the fever and the pain. In other scenario, in case of overdose, it is causing liver damage. This is the very simple explanation ma. What does the drug does to the body? The drug is doing two things. One is positive effect, one is negative effect. Positive effect is which is we want. Okay, we want. Majorly this negative effect we will not consider ma. We will omit or neglect it, because these are the adverse effects or side effects the drug is producing. So the major effect is it is producing relief in pain and relief in fever, and the mechanism is through inhibiting the COX enzyme, through inhibiting the prostaglandin. So we are studying about the result and how it is, how the pain or fever is reduced. Means this mechanism of action, we want to know about this mechanism of action. Okay, it is inhibiting the COX enzyme in the brain, ultimately prostaglandin is reduced, so pain and fever are reduced. So the output is pain and fever are reduced. The reason or mechanism behind is inhibition of COX enzyme followed by inhibition of prostaglandin. This is the two mechanism. Okay, now we will go into pharmacokinetics ma. Okay, what is pharmacokinetics? What body does to the drug. See, what body does to the drug. Actually ma, first pharmacokinetics, next is pharmacodynamics. First the thing, if I eat the tablet, first pharmacokinetics only happen, second only pharmacodynamics. Okay, it is A, after A only B will come, Noma in alphabets. Same way pharmacokinetics, then only pharmacodynamics will happen. Okay, so actually I have explained pharmacodynamics first and pharmacokinetics second, but pharmacokinetics is first. So I am eating a tablet X. Okay, after I am eating the tablet, I am putting on tablet, I have drinking some water. So the tablet, the body have to take the tablet, Noma. First the thing is the the body have to take the tablet. Okay, so what the body does to the tablet, the body is doing something ma. The body is doing something to the tablet. What does the body do to the drug? See, after consuming the drug, I am taking the tablet, the body does ADME. What is ADME? A stands for absorption, D stands for distribution, M stands for metabolism, E stands for excretion. And metabolism plus excretion is known as elimination. So what is doing? Absorption. After I drink that water, first I take the tablet, then I am drinking some water. So the tablet, first it goes from my mouth, then esophagus, then it's going to the stomach, then it is going to the large intestine. So in the stomach, the drug will get dissolved, no ma. It will break down. The large drug will break down into smaller particles. Okay, then it goes into the small intestine. In small intestine, the drug enters from GI tract to bloodstream. Okay, that is known as absorption. See, absorption. How a drug enters the bloodstream from its site of administration is known as absorption. See, the paracetamol tablet I am taking in the small intestine, it is absorbed into the blood. Okay, from the small intestine, majority of the drugs are absorbed in only small intestine. Okay, so absorption is nothing. Absorption is like entering of drug substance from the body to the bloodstream. Okay, next is distribution ma. the drug is now the drug now how to spread in the body fluid. Okay, distribution is nothing but the drug has to spread into the body fluid and tissue to reach its site of action. See, our in the first case, see the paracetamol, it is in the stomach it is broken, then it is going to small intestine. In small intestine, it is absorbed into the in blood. It will the paracetamol will get spreaded in all over the blood, in the full blood present in our body, and the blood will travels in the body. So it has to reach the site of action. What is the site of action? Paracetamol has to reach brain. The site of action is brain. So see, first the paracetamol tablet, first is mouth. From mouth it's going to stomach. In stomach it is broken down. Next it is going into small intestine. In small intestine it is absorbed. Okay, in small intestine it is absorbed. It is coming into blood. It is coming into blood. Okay, in the blood it is circulating. It is spreading. It is spreading and going to brain. Okay, this is known as distribution. From blood, from the blood it is going to reaching brain. This is distribution. And the distribution also depend upon many factors like the blood flow. If the blood flow is very fast, it can go to the brain very fast. Then protein binding, like lipid solubility, like certain factors are there. The distribution also depend upon these factors. Next, metabolism, how the drug is broken down. After this, the drug is reaching the brain. After the fever or pain is reduced, the drug has to be broken down. Okay, metabolism is nothing but how the drug is broken. So majority of the metabolism take place in liver ma. Okay, then after the drug is broken down, it has to be excreted. So excretion say about how the drug leaves the body. Once the liver metabolize the drug or broken down the drug, the broken down drug is excreted through kidney in form of the urine. Okay, majority of the drugs are excreted in urine only ma. Okay, so see, if I'll give a glance about PK of paracetamol, where does the absorption take place? In the small intestine. Okay, small intestine. In the gastrointestinal tract, small intestine, absorption is taking. Distribution, it is distributed in the body fluid, blood. Then metabolism is nothing but how the drug is broken. Suppose paracetamol is there. And the paracetamol, if the paracetamol drug is there, the drug has to get broken. No, so how the liver broke means first it does like glucuronidation and sulfonation. These are two chemical reaction. These two chemical reaction paracetamol undergo and it get broken down. So in and the after broken down, it is excreted in urine. Okay, it is get excreted in urine. So these are about pharmacokinetics and pharmacodynamics ma. That's it. Thank you ma.